Hello, welcome to Module 1 of Cervical Cancer. I'm Dr. Adlina, Family Medicine Specialist from Clinic Kesehatan Kulai. Today, I'll be presenting an important topic, cervical cancer, a condition that is both preventable and treatable if detected early. In today's session, we'll go through the basics of cervical cancer, including its introduction and epidemiology, risk factors, the role of HPV and vaccination, and lastly, the signs and symptoms of cervical cancer. After completing this module, participants will be able to explain the disease burden and epidemiology of cervical cancer in Malaysia, identify the main risk factors for cervical cancer, with emphasis on the role of human papillomavirus, HPV, infection, describe the importance of HPV immunization in preventing cervical cancer, including available vaccine types and target populations. Recognize the early and advanced symptoms of cervical cancer that require attention for effective early detection and intervention. Cervical cancer is one of the leading causes of cancer-related deaths among women. In Malaysia, it was reported that between 2017 and 2021, cervical cancer dropped from the third most common cancer to the sixth most common cancer among women. However, there was an increase in the percentage of cases diagnosed at late stages, stage 3 and 4. Reduced access to cervical cancer screening during the COVID-19 pandemic is likely a key factor contributing to the increase in late-stage diagnoses. Almost all cervical cancer cases are linked to HPV infection. Fortunately, HPV is preventable through vaccination and early screening. Detecting pre-cancerous lesions allows timely treatment and prevents progression to cancer. This graph compares the incidence of cervical cancer among women in Malaysia between 2012 to 2016 and 2017 to 2021. While there's a drop in its ranking among female cancers, we must remain vigilant, especially given the rising rate of late-stage diagnoses. Compared to 2012 to 2016, a reduced incidence rate is seen in most age groups in 2017 to 2021. Additionally, two peaks in the incidence rate are identified, which are age 55 to 64 and age 70 to 75. What are the risk factors of cervical cancer? Cervical cancer is primarily caused by infection with certain types of human papillomavirus, or HPV, a virus that is transmitted through sexual contact. Several risk factors can increase a woman's likelihood of developing cervical cancer. These include having more than 3 sexual partners, engaging in sexual activity before the age of 17, or having a first childbirth before turning 17. Other contributing factors include high parity, which means having 7 or more full-term pregnancies, and long-term use of oral contraceptive pills, particularly for more than 10 years. Smoking and living in a lower socioeconomic environment also increase the risk. Understanding these risk factors is crucial for effective prevention and early intervention. Human papillomavirus, an overview. HPV is a non-enveloped, double-stranded DNA virus with over 100 types, more than 40 of which are anogenital, and about 15 of these are oncogenic. It spreads primarily through skin-to-skin contact during sexual activity and is highly contagious. 50 to 80% of sexually active people will be infected at some point in their lives. HPV. Infection facts. Most HPV infections clear on their own within 2 years. However, persistent infection with high-risk HPV types is the main cause of cervical cancer. Around 80% of women will acquire HPV by age 50. HPV 16 and 18. High-risk HPV types. HPV types 16 and 18 are responsible for most cervical cancers. HPV 16 causes around 55 to 60% of cases, and HPV 18 accounts for 10 to 15%. These two are the main targets of preventive vaccination. Pathogenesis of cervical cancer. For most people, their immune systems will clear the HPV infection with no harm caused. However, when the HPV infection left untreated, uncontrolled growth of abnormal cells can become cancer. Persistent infection with high-risk HPV is necessary for the development of cervical cancer and its precursor lesions. Only about 4 to 10% of HPV-infected women become persistent carriers, and they typically remain undetected until middle age, putting them at high risk of developing cervical cancer. HPV vaccination. There are 3 types of HPV vaccines: bivalent, Cervarix, quadrivalent, Gardasil, and nonavalent, Gardasil 9. Malaysia began its national immunization program in 2010. WHO now supports a single-dose HPV vaccine as being just as effective as the 2-dose schedule. What is the impact of HPV vaccine? A study by Ku et al. Shows a significant drop in HPV 16/18 prevalence among women aged 18 to 24, from 4.0% to 0.4% over the years. This reflects the success of vaccination programs. Signs and symptoms of cervical cancer. Cervical cancer is often silent in its early stages. When symptoms do appear, they include abnormal vaginal bleeding, discharge, pain during sex, and pelvic pain. Advanced cases may present with urinary or bowel issues and leg swelling. Kindly please refer to these guidelines for further details. I hope you enjoy my lecture today. See you in Module 2. Thank you. It's time for the quiz. Answer all 5 questions correctly to receive a certificate. All the best.